Hey everyone, it's Dr. Nicole Rochester, founder and CEO of Your GPS Doc. I am here with another Patient Safety Awareness Week tip. Yes, we are still in the midst of Patient Safety Awareness Week, and I have been bringing you tips all week to help you and your family members stay safe in healthcare settings. Today, we're going to be talking about healthcare associated infections and the importance of, guess what? Hand washing. So I want to share some statistics with you all. It is estimated in the United States that there are 1.7 million healthcare associated infections every single year and 90,000 deaths from those infections. What do I mean when I say healthcare associated infections? Those are infections that individuals get as a result of their exposure to healthcare. So it may be infections that patients get in the hospital setting. Those are the ones that are measured most often. But you can catch infections in your doctor's office as well. You can become infected based on your contact in radiology facilities and in lab facilities. So 1.7 million per year. Can you all believe that? It's estimated that about every 1 in 25 patients is impacted by healthcare associated infections here in the United States. Now, the sad thing about that data is that the number one way to prevent healthcare associated infections is a very simple act: hand hygiene or hand washing. Now, we're in the midst of COVID, right? We're in the midst of the COVID-19 pandemic. So now everybody in the entire world is very familiar with the importance of hand hygiene. And early on, they started talking to us about the importance of washing your hands. Do you guys remember last year, back in the spring of 2020, when you could not find a single thing of hand sanitizer in the stores? Do you remember that? I mean, even as late as maybe a couple of months ago, it was still difficult, at least here in Maryland where I live, to find hand sanitizer. And so we as a country, as a world, have appreciated the importance of washing our hands and using alcohol-based hand sanitizer in the midst of the COVID pandemic. But this has always been a very important topic in healthcare. And I have something else that I need to share with you. Would you believe me if I told you that about 50% of the time, studies have shown that healthcare workers are not practicing appropriate hand hygiene? It pains me to tell you all this, but it is absolutely true. And I can share with you that in every hospital that I've worked in, there have periodically been campaigns to try to get the doctors and the nurses, although I'm going to be honest, the doctors are usually the worst culprits, to wash their hand. Now, I find that embarrassing that hospitals have to tell people to wash their hands and that we have to have campaigns that remind healthcare professionals to wash their hands. However, that is the situation. And so it's important that you understand this and that you and your family members know about this problem, because one of the ways that you can protect yourself and your loved ones and that you all can stay safe and that you all can limit or prevent your chances of being infected in healthcare settings is to be vigilant about the requirement that healthcare workers actually practice good hand hygiene. I want to tell you very quickly about a study that was done where they identified 5 moments for hand hygiene. In this study, the first moment is before touching a patient. Now, I don't care what they may have done before they walked into your exam room, before they walk into the little area where you are in the emergency room, before they walk into your hospital room. It is important that you see that the healthcare worker, the healthcare provider, has washed their hands, okay? Whether or not they plan on touching you or not, it's just good practice. As a patient or family caregiver, I know it may seem awkward, but I am recommending that if you are in a hospital setting, if you are at a doctor's appointment and you don't see that healthcare provider wash their hands, whether it's with soap and water or with a hand sanitizer, that you speak up and say, "Excuse me, would you mind please washing your hands first?" That's it. There's no judgment. If they say, oh, I already did it out there, you could say, well, I'm a little bit of a germaphobe. You make up something. I've seen a video about this and I was just told that it's important that I see you do it, or whatever you want to say. But you can make this statement without passing judgment. And honestly, the healthcare provider should be able to accept that without being defensive. Okay. So again, I know that it's awkward, but all you have to say is, excuse me, would you mind washing your hands first? That's it, okay? So I know one thing that I would do. So at the hospital, there would be a hand sanitizer dispenser right outside of the exam room. So what I would do is I would knock. Then once they said come in, I would open the door. Then I would get the hand sanitizer. And then as I was walking into the room, I was doing this. It was important to me that my patients and their family members saw me washing my hands, okay? So that's something that, healthcare workers and healthcare providers should do. Or after they go into the room, there's usually another hand sanitizer dispenser inside of the room. They can get their get their sanitizer. And then in front of you, they should be washing their hands. Because guess what? If they do it outside the room and then touch that door handle, guess what? They have just contaminated themselves. That's why it's important that you see them doing it and that they are doing it inside of the room in front of you. Moment number 2 is before aseptic procedures. Now, without getting into a lot of medical jargon, basically what this is referring to is that before healthcare providers are going to be doing a procedure that requires their hands to be clean, which is pretty much any procedure, but we're talking about things like maybe changing your bandage, maybe giving you an IV medication, inserting an IV, removing an IV, those types of things. Their hands should be clean. So if a nurse is coming into your hospital room and he or she is about to give you a medication, they should wash their hands first. If someone's coming in to change your bandages, they should wash their hands first. Moment 3 is after touching a patient. So what good is it if we wash our hands and then we touch you as we're examining you, and then we just go on and pick up our pen and write notes, or go to the computer and then go there and then leave your room? Now what's happening is that you may actually be infected, or you may have particular bacteria that you're colonized with on your skin. And now that healthcare provider is taking your germs to the next room, to the nurse's station, to the doctor's lounge, to wherever their next destination is. So that's the third moment. After touching a patient, they should also wash their hands. The fourth moment is before touching patients' surroundings. I just gave you that example where once they have done something that potentially contaminates their hands, they should wash them before they handle the surroundings in your room, before they touch your bedside table, or before they pick up your telephone to help you make a call. And then the fifth moment is after exposure to bodily fluids. So if a aide or a tech or a nurse or even a doctor is helping to empty your urinal, or in any way handling maybe some tissues that you've coughed into that may have sputum in them, any type of bodily fluid should always be considered contaminated. And so after a healthcare professional has touched those items, they should wash their hands. And guess what? The same applies to you. You should wash your hands in these same situations. So those are the 5 moments. So this is extremely important because, as I mentioned at the beginning of this video, people die from healthcare associated infections every single year. And these are preventable. Something just as simple as washing your hands with soap and water. You guys by now have probably seen all the videos, in the midst of the COVID pandemic, where they've shown us about how you should wet your hands first and then put the soap in there and then wash vigorously, singing happy birthday at least 2 times. And this is with warm water ideally, and then rinsing that off, and then using a clean paper towel to dry your hands and then throwing that away. This is how you would wash your hands with soap and water. Otherwise, you can use an alcohol-based hand sanitizer that has at least 60% alcohol. And again, you want to squirt that in your hands and you want to wash vigorously. You don't want to just go like this. You want to wash vigorously, making sure that you get all of the surfaces in between your fingers, the front and the backs of your hands, and make sure that it dries completely. This is very, very important. The key as a patient or family caregiver is to know that healthcare associated infections are frequent, they are serious, and they can cause death. And that the number one way to prevent these is appropriate hand hygiene. So you can help all of us by being vigilant, by knowing when a healthcare professional should wash their hands, and if you don't see them doing that, providing that gentle reminder. Don't let your desire to be polite get in the way of your safety. So if someone is approaching you, they're about to deliver medical care to you, they're about to touch you or examine you, and you have not personally seen them wash their hands or use hand sanitizer, then just gently and politely say, "Excuse me, would you mind please washing your hands first?" All right, you all, I hope that this was helpful. As always, I ask that you share this video with others in your circle. Please like and subscribe to the Your GPS Doc YouTube channel, and I'll see you next time with another tip. Take care and stay safe.